Good morning. This is Dr. Shanthala. So today I'm demonstrating how I perform masseter muscle injection in my practice. And this beautiful girl is suffering from what is called as bruxism. Bruxism is a condition where they clench their teeth at night, they grind their teeth, they get headaches, the muscle is really very strong, and they have like a square shaped face, and they can have TMJ joint problems, and it also affects their dental enamel, ruins their teeth. So, and it causes premature aging. So, for all these reasons, I think treating this bruxism is essential. I'm marking the area in such a way so that I can prevent complications. So, it's really important to really focus on the precise area, the way you inject, the depth of injection, and the dose of the neurotoxin which you're going to use. My upper border, the superior border, is from the corner of the mouth to the earlobe so that I can prevent accidental injection deep into the either pterygoid muscle or even the parotid duct. Now, the anterior border is I feel the actual muscle, and I make sure that I am away from the facial artery, and also I don't want to accidentally inject the risorius muscle. Inferiorly, I feel the border of the mandible, and I don't go too close to prevent accidental injection of the marginal mandibular nerve. So as you see, I'm doing 3-point injection, and it's very simple. I keep the dose on a lower side in the beginning. I can always add more. So it's a very simple injection which can really help you, and I would love to take care of you. Thank you so much for watching.